Our speaker is Klodiana Myftari. Dr. Myftari is Assistant Professor of Pharmacy Practice at Midwestern University, Chicago College of Pharmacy. She received her Doctor of Pharmacy degree and completed a PGY1 residency with a focus on community pharmacy from the University of Illinois at Chicago College of Pharmacy, and is board certified in ambulatory care. She has over a decade of experience in implementation of pharmacist services in community pharmacy, ambulatory care, and population health management. Dr. Myftari currently practices at Rush University Medical Center as clinical pharmacist with the Department of Population Health. She is leading the implementation and evaluation of pharmacist services in population health management via digital medicine, telehealth, and traditional face-to-face practice models. Dr. Myftari?
Yes, thank you, Trish, for the presentation. I have no conflict of interest to disclose. This is just an abbreviation slide that I hope may be helpful as you try to refer back to some of the information that we're going to review today. And my perception and the way I want to talk to you about today about social determinants, specifically related to social determinants of health, comes more from my 5 years of practice as a clinical pharmacist in the Department of Population Health at Rush University Medical Center, where I work with a significant number of patients who have positive social determinants of health factors, and I see the impact that that has on health every day. These are the objectives that I hope to review with you today. And additionally, I'm hoping that as part of this appetizer, you will leave wanting to learn more about social determinants of health and diving into some of this data and taking a more active role as we continue to create strategies to improve better health outcome for our patients. So I want to start with one patient case, a patient case that may seem very common on the practice that you have every day. This is a 43-year-old male who is currently inpatient for management of cellulitis. Patient's past medical history is listed on the slides and is significant for uncontrolled diabetes, substance use disorder, post-traumatic stress disorder, and chronic kidney disease. Patient's family history, he lives with a partner, he's unemployed currently and sexually active. And social history, patient smokes and has been smoking for over 10 years with more than half a pack per day. Medication list as discharge is listed on the slide. So my question to you is, based on this information that we have on the slide, what are some of the social determinant factors that you believe may affect these patients' health outcomes? And we'll take a few seconds. If you could please write your the factors that you believe will impact this patient's outcome, and we'll be able to see them on the screen. Okay, unemployment. Yeah, that was pretty easy to spot from the information that's in the chart. It's typical information that we see in our EMRs. So yeah, that is exactly one of the factors that can impact this patient. So let's talk a little bit about social determinants of health. Healthy People 2030 has the aims to improve the health of a nation based on 355 objectives, which are categorized in 5 different categories, including one of them being social determinants of health. However, in order to improve the health of a population, we need to be able to recognize what determines one's health. And with the data that we have today, it is the consensus that over 60% of one's health is determined by social, environment, and patient choice. 30% by genetics, predisposition, and only 10% by medical care, which is the space where we as healthcare professionals spend a significant amount of time. However, the challenge is, do we have opportunity to expand our reach beyond just the medical care? And how do we do that? The picture on the left side, it's meant to create an image of the relationship between the different factors that I just reviewed, the genetic, the patient choice, the social determinants of health, and then how that is impacted by social determinants of health equity, which includes social concepts like racism, sexism, and classism, which can impact, and the policies that have been designed based on those social concepts can impact social determinants of health. And social determinants of health, it is by World Health Organization definition, it is the condition in which people are born, grow, live, work, and age. The Healthy People 2030 summarizes 5 pillars of the social determinants of health: education access and quality, healthcare access and quality, neighborhood and building environment, social stability, and social and community context. And the next slide, the table summarizes and it goes to specific individual elements of the 5 pillars. So it is easy to see how the violence in one's neighborhood can impact their physical activity and ability to walk outside. You can imagine how lack of transportation can impact medication access, access to the grocery store, access to care, to go into the physician's offices. Lack of libraries, parks, quality education can have an impact on one's literacy. And pharmacy deserts, this is an issue that we as pharmacists are very much aware of. Housing that is linked to economic instability due to job instability, due to lack of job opportunities that may lead to debt and medical bills. So these social determinants of health factors, while we identify them as individual pillars and individual factors in each pillar, they usually do not live alone, but they intertwine throughout one's life. And they lead to health outcomes like morbidity, mortality, health expenditure, health status, functional limitation, and decrease in health expectancy, as we're going to see in some of the data that we're going to review. So let's go back to our patient case. So this was our patient, the 43-year-old, that we identified unemployment as being one of their social determinants of health factors. Well, now as a pharmacist or a pharmacy intern or maybe a pharmacy technician interacting with these patients, you learn a little bit more about the patient. After interviewing the patient, you learn that the patient is a painter. He currently lives in a household with 5 other adults, and he describes his living situation as chaotic. There are illicit drugs being used in the house. However, patient denies using those drugs. Per patient, food access is limited. He does not drive, therefore there is limited transportation support. Patient was without an insurance for a few months due to his losing his job as an instructor at our institute. And he reports that he's adherent to all his medication when he has access. So my question to you, based now on the information that you learned about social determinants of health and information that you obtained from interviewing the patients, what are some of the factors that may affect these patients' health outcomes? Unstable housing, limited transportation, food insecurity, substance use disorder, unemployment, limited access to medication, and all of the above. Yeah, you are correct. Many of you answered all of the above, and that is the correct answer. What I want to point out here is that our healthcare system, as is right now, especially our EMR, are not designed to actually capture all the patient's social determinants of health. So while we continue to develop ways to do that better, it is important for us as healthcare professionals, as we interact with our patients, to be able to use the trust the patient has on us to capture and to identify some of these factors. I want to bring some attention to social determinants of health, not only as a global factor or as a national element that affects our nation, but I want to bring that home. In the map here, you can see a Rush University Medical Center. This is the center where I practice. And about 3 miles west of that, it is the Garfield Park, where the life expectancy of the population there is only 69 years old. Versus if you go 3 miles northeast, the life expectancy, it is 85 years. Westside United, which is a multi-institutional organization, analyzed the data and came out to the conclusion that the main cause of this 16 years gap in life expectancy is due to heart disease in the heart of Chicago. In 2017, a survey by Sinai Urban Health Institute showed that 40% of men and 50% of women in the South Lawndale, which is really just a little bit south of Ramsey, reported that their health is either fair or poor. And this national data is usually at about 12%. And the last thing that I want to point out is that pharmacy deserts in the middle of Chicago, it is an issue that is impacting our patients. So health, social determinants of health, it's not just a global issue. It's not just a problem for United States in general. This is a problem for our patients that we see every day. So let's talk a little bit about the health outcomes. Data from JAMA that was published in March of this year lists here the causes of death for 2020. Heart disease remains the top one and continues to grow. Cancer, COVID-19, obviously, we're all aware, has made a significant impact on the death rate in the United States. And then as you can see, other chronic conditions, including diabetes, asthma or COPD, other infectious diseases have played a significant role. So I'm going to touch base on some of the data that supports how social determinants of health affects many of these major leading causes of death in the United States. We'll start with infectious diseases because this has been in everyone's mind over the last year and a half, and we continue to be in the midst of the pandemic. As we saw, infectious infectious disease account for a substantial morbidity and mortality, and it is led not only by patient individual level determinants, but also by population level determinants. Prevalence of the infectious agents, effectiveness of preventive and control intervention, and also social and structural environment factors. This table that was published by CDC in 2020 shows the disparities of the outcomes that COVID infection has had in a minority population, when American Indian, Asian, Blacks, and Hispanic population is disproportionately affected by hospitalizations and death from COVID-19. The data that was published most recently in June of 2021 shows that the death rate among American Indian compared to the whites, it is at 2.3% versus the Blacks stand still at 2%. And then the Hispanic, it's also at 2.3%. So the death rate on the minority population has increased. This is explained really by the factors that increase community spread and individual risk: crowded situation, close physical contact, enclosed spaces, and the duration of the exposures that can be impacted or have been impacted by social determinants of health. Patients of color usually work more in the blue-collar jobs, which does not allow for work from home, like some of us had the privilege to do so. Lack of housing or housing instability has made it harder for patients to live in situations where they can prevent exposure. Lack of social support made it very hard for patients who had COVID and staying in isolation for them to be able to get the care that they need, for them to be able to get the resources that they need. Transportation, access to care, these are all social determinants of health that they led to negative outcome from COVID-19. However, exploring the social determinants effect on infectious diseases is just not a new topic. There's been many of studies in the last few decades that have examined how patient experience homelessness or home stability has an impact in HIV and AIDS population. Stable housing can cause decrease in mortality and also is associated with better adherence with HIV treatment. Substance use disorders, specifically patients who use injectable drug use, they are increased with the death from hepatitis B and C. There is increased risk for HIV outbreaks, and there is significant increase in endocarditis hospitalization and hospital cost. So this is just some highlights that talked about infectious disease and social determinants of health. Now we're going to switch gear and talk a little bit about heart disease, the main cause of death in the United States. In 2015, the American Heart Association published a statement that highlighted the effect of social determinants of health on heart disease, with a goal on increasing awareness on the social determinants of health and hopefully coming up with strategies that may impact and improve the outcome for the population affected by these factors. They use social economic position as a factor, and they found out that education plays a significant role in increasing risk for cardiovascular disease, or lower education is associated with increased risk of cardiovascular disease, increased mortality, and increased hospitalization from cardiovascular disease. And I hope that next time when we have a little more time, we can dive into some of their research a little bit more. This is a table from a more recent study, 2021, from the Journal of American Hypertension that was published recently, that highlights how the social determinants of health affects hypertension, stage 2 hypertension, and controlled blood pressure among US adults. And as you can see from this table, again, uninsured patients are associated with lower control of the blood pressure. Unemployment is associated with higher risk of stage 2 hypertension, or for women. Education level, again, plays a significant role in presence of hypertension and stage 2 hypertension. Diabetes. As pharmacists, regardless of what setting we're working on, we are working with patients who have diabetes. And limited access to grocery or produce outlet results in a population with a significant higher risk of obesity and diabetes. Lack of family support and lack of knowledge about the progression of a disease are also associated with less inclined to initiate therapy and get patient to the hemoglobin A1C goals. As I mentioned earlier, though, the social determinants of health factors usually do not live alone. So medication non-adherence for chronic conditions has a big impact on the outcome of these conditions. And we'll talk about medication adherence in a moment. Asthma, another one of those chronic conditions where pharmacists play a significant role. The African American are disproportionately burdened by asthma. And the first study that is highlighted on this slide, it is a study of African Americans' asthma, genes, and environmental. It's a stage 2 study. It is an ongoing case control that was initiated in 2008. And some of their findings speaks to how lower income is a stronger predictor of poor asthma control. Mother education level is a stronger predictor and is associated with poor control, financial status, and uninsured population also has a worse outcome. A more recent study, there was a review that was conducted, the review of publications that evaluated social determinants of health on asthma between 2014 and 2019, also highlights the impact that social determinants of health has on asthma. And they highlight a significant number of studies that focus in the Midwest and across the country where the housing and the housing situation and the impact that the greenhouse has had on improving asthma outcomes. Social determinants of health and cancer. While cancer continues to be the second leading cause of death in the United States, I added this here in the end after we talked about some of the other chronic conditions because I wanted to highlight the fact that social determinants affect the risk factors for cancers, like obesity, for example. Additionally, comorbidities like diabetes, hypertension, heart disease affect the cancer treatments and therefore the outcomes. Access to care and cancer screening, it is another significant element that is impacted by health, by social determinants of health. The table in the screen shows how the area deprivation index, which is a summary of 17 elements of social determinants of health, impact the screening for breast, cervical, and colorectal cancer. Additionally, the rurality also is affected with the decrease of cancer screening. And as we know, early screening and early detection is one of the initial steps that can ensure better outcome of patients who have cancer. ED utilization. ED utilization and hospitalization and hospital readmissions are identified as one of the strategies that can help reduce the cost of care in the United States. And it is undeniable that we as pharmacists play a significant role in improving medication access and helping patients to optimize medication use during transitions of care. However, it is important for us to recognize that the ED is the primary source of care for population with high social determinants of health needs. Some of the patients that I serve today use the ED as a place where they can get a meal. ED is utilized as a place where they can get shelter, where they can escape violence, whether it is from the outside or whether it's domestic violence. This is a place where sometimes patients go in just to get a break from their life. So while we need to continue to work on improving transitions of care to reduce hospitalization and reduce ED utilization, it is important to note that as a system, we're not going to be able to get the outcomes that we need unless we start addressing and investing in some of the social determinants of health elements that have a significant cost. The reference in the slide is a systemic review that was published in the Academic Emergency Medicine in 2008. And the table here summarizes the number of studies that demonstrated how each specific element of social determinants of health has impacted the health outcome, has had negative impact and increase in ED utilization. And lastly, medication adherence. This is our domain. We take accountability as pharmacists to ensure medication access, to ensure medication use, and optimize medication use for our patients. There is a lot of data that speaks to how medication prices, lack of insurance have impacted medication use. And this is something that we as pharmacists, pharmacy technicians, pharmacy interns see almost on a daily basis. The systemic review and meta-analysis highlighted in the slide, it focuses on other social determinants of health factors that are not related to cost and to insurance access. There were, out of the 3,000 abstracts that were reviewed, 29 articles met the criteria. It focuses in the US and focuses specifically in other social determinants of health factors and medication adherence specifically, and they were analyzed. These 29 articles demonstrated a significant relationship between medication adherence, food insecurity, housing instability, and other social determinants of health factors overall. Some of the studies that spoke to ED utilization demonstrated that 25% of patients who utilize ED reported cost-related medication non-adherence. 8.6% and 19.7% has chosen between food and medicine, which makes sense because if the patient's essential needs are not going to be met, then their focus on their disease states or medication adherence, it is not going to be a priority. Transportation continues to be a barrier for many of the patients that I serve, and I'm sure many of the patients that you serve. And while many community pharmacists around the state and around the nations have been trying to help overcome these barriers by offering delivery, by offering telehealth, the questions that we don't know the answer to, are those services reaching the people who really need it? And that is a room for more research in the future. Health literacy. As pharmacists, we are very much aware of what health literacy does, and it's important to medication use. However, a lot of times we overestimate patients' ability and their health literacy. What I want to show you very quickly, it is this map, this health literacy map that was built by the University of North Carolina that shows you exactly the literacy level of the population that we serve. Let's begin. And if we go into Illinois, so depending on where you practice in Illinois, just go and highlight the area where you practice. And I'm going to go right here in Chicago, a little bit more Oak Park, right here where you see this red dot, which means that a high percentage of the population, it's on quartile 1, which means that they have 60% literacy level is below the basic. And we're talking just literacy. We have not touched base on the health literacy yet. So what I want to mention to you is that again, we are aware of literacy issues, health literacy issues. We tend to overestimate. So spending some time to assess patients' ability to follow through on the recommendation continues to be something that we need to invest in. And before we address this question, I also wanted to talk about pharmacy desert. And I have made this point multiple times. It was very hard for me to understand the pharmacy desert in the middle of the city of Chicago. So I can only imagine how that may impact other patients in rural Illinois. And speaking as a pharmacist who's worked with population who has barriers to medications, this is something that we really need to continue to investigate and figure out strategies of how we're going to help patients overcome. So with this information, it brings me to our second assessment question. Based on the information discussed today, which of the following statement is true? Homelessness and housing insecurity associated with an increased mortality in HIV and AIDS population. Greenhouse's environment had led to fewer asthma attacks and hospitalization due to asthma. Medication adherence is significantly impacted by social determinants of health factors, and that food insecurity is associated with increased ED visit, hospitalization, and readmissions. And yes, you're all correct. E, it's the right answer. All of the above have an impact. So in conclusion, social determinants of health factor are associated with increased cost of care, decreased life expectancy, increased mortality, and morbidity. It is our responsibility as healthcare professionals to recognize and support patients who are experiencing social determinants of health. And as pharmacists, I really want to encourage us to continue to play our role, continue to be active in the conversations, and be part of the solutions that the healthcare is designing. We talk about healthcare transformation, and this is a transformation that will need to happen, and social determinants of health factors will need to be addressed as we move towards a value-based care if we want to reach the outcomes and if we want to decrease the cost of care. Pharmacists and pharmacist technicians, as one of the most trusted professions, we have a great opportunity to not only assess for social determinants of health factors, but also direct patients to the right resources and help support them with medication use. And I want to specifically point out the role that pharmacy technician has, especially those of you who may practice in the community pharmacy. That is an area where you can make a significant impact. As pharmacists, we usually talk about medications and the benefit of a medication reducing or increasing the life expectancy by 1 day or 1 week. Here we're talking about expanding life expectancy by decade. As I'm concluding, I want to say thank you to 2 of my pharmacy students, Nicholas Hardmanis and Dovidas, who have helped put some of these resources together. And also want to share with you a slide that has additional resources for all of you who want to learn more and want to take a more active role in this, create innovative ways that we can overcome these barriers. This is a national conversation. PQA just about a week ago came up with a call for contribution for pharmacists and pharmacy interns and students like you to list the interventions that you may implement in your institutions and to speak to that experience and their outcome. So I hope that in the near future, I will hear and read for some of your work. And these are the 2 students, again, Nicholas Harmanis and Dovidas Peskovich. Thank you so much for helping out and putting some of these resources together. And with that, I am ready to open it for any questions that you may have. Thank you so much for your attention.
Thank you, Dr. Myftari. really interesting but kind of sad situation that we're facing, and it's going to be a challenge to find some solutions to that. I have a question talking about those challenges of how we reach the people who don't have access to computers, telephone, cell phone. When we talk about telehealth, how does telehealth work when these individuals don't have access to the equipment?
Yeah, that it really doesn't work. So telehealth, it's not a solution for those patients who do not have access to a telephone, or for those patients who do not have access or do not know how to use a computer. So that, while it's helped a lot of our patients that we serve, it is not reaching those who do not have access to tools to use telehealth. So we really have to catch those patients while they are in our systems when they come to your pharmacy, and try to provide them with the resources that they need or the education that they need, or connect them to their physician's office and try to do a more proactive role in those times when you have those patients in front of you.
Great. Well, I think we could probably, as you alluded to, have a much longer presentation on this topic, as well as on what some of the solutions might be. Thank you, Dr. Myftari, very much for serving as a speaker on this interesting topic, and we'll have to have more and more education on this.
Thank you.